Going to RolandMartinUnfiltered.com, you can make this possible. All right, folks, there's a whole lot of misinformation circulating on social media about how to protect yourselves from COVID-19. You got these people walking around, wrapping themselves in trash bags, going to grocery stores. I don't know what the hell. Some people talking about you can eat garlic to prevent infections. All right, joining us right now is Dr. Sadrina Calder, a board-certified preventative health physician. Doc, how you doing?
Hi, how are you?
I'm doing great. All right, so you hearing a lot of this crazy stuff out here, and then you got people who coming up with their grandmother, grandmama, granddaddy, back in the day remedies, all this sort of stuff like this here. In fact, I had a tweet a little bit earlier. Even Trump, all the lying that he did about this particular drug. In fact, he stood before the cameras and said that the FDA approved it. That was actually a lie. FDA did not approve it. They're still sitting here. Again, here it is. The FDA has issued a statement clarifying the chloroquine situation. Trump wrongly said the anti-malaria drug was approved for coronavirus. The FDA statement says there is no approved coronavirus treatment. And so what are some of the crazy stuff that you're hearing out there as well?
So I'm hearing a lot of misinformation just across the board, all over social media, probably on a daily basis. One of the first things I heard was that Black people couldn't get the coronavirus.
That's a lie.
And that, exactly. I mean, we've already seen a few NBA players that have been diagnosed with it, Idris Elba, etc. So, yes, that is definitely a myth. I don't know how we came up with that, but the coronavirus does not discriminate against anyone. So,
all right.
Another myth. I'm sorry.
No, go ahead.
Another myth is that antibiotics can treat it. That's completely incorrect. So this is a virus that we're dealing with. Antibiotics are used to treat bacterial infections. So that's definitely not true.
Okay, so what about all these people who again, like we showed these fools who were spraying their kids with I'm sorry, you can't spray your kids with Purell and think that that's going to ward off coronavirus.
I agree. Dousing yourself in disinfectants is not the appropriate way to prevent getting the disease. You can actually be doing harm to yourself. Those are chemicals that you're putting on your skin and potentially inhaling into your lungs. So this is not something that we recommend at all. We continue to recommend the same preventive measures that we've been pushing: social distancing, washing your hands, avoiding sick contacts. If you're sick, keeping yourself away from everyone else and at home, covering your nose and your mouth when you cough and sneeze. Those are the types of things that you can do to properly prevent it.
What about this? Okay, so first, is there anything that we can do to fortify our immune system that would keep us strong? So even if someone does contract it, you still have a strong enough immune system. Anything we should be taking?
So there's nothing that you can do in terms of boosting your immune system to prevent it from happening, but you can kind of continue to maintain a healthy immune system if you do have one. And that's just by eating a proper diet. So you want to eat enough protein, healthy sources of carbohydrates, healthy fats, get enough sleep. That's a big thing. Getting at least 7 to 9 hours of sleep per night. Exercise.
7 to 9?
Yes.
Hell, that'd be a miracle if I slept 9 hours.
Yeah, I think most people have difficulty getting that amount of sleep, but that is the recommended amount.
Doc, how many hours you sleep?
Brother, half that if I'm lucky. But I'm listening to the doctor. I want to live, brother. I want to live.
Dr. Calder, how many hours you sleep? Dr. Calder, how many hours you sleep?
I'm sorry. I'm still trying to make sure I get to that 7 every day. I have trouble with that as well.
Child, please. Yeah. If I get to 6, that's a miracle.
No question.
Yeah, for me too. 6 is doing pretty well for me, but I'm still aiming to try to get 7 every night.
I got you.
That's something I struggle with now, and I continue to work on. But in addition to that, just making sure you're eating enough fruits and vegetables so that you get all the proper vitamins and minerals that are needed to maintain a healthy immune system.
Folks, for y'all on Facebook or YouTube, you got any questions or Periscope, go ahead and post your question, and I'll ask you real quick. Risa, you got a question?
No.
Erica, you got a question for Doc?
Absolutely. Good doctor, thank you so much for joining us today. Wanted to find out how can we, the general public, communicate the severity of the virus to the younger population. I have a 20-year-old son who's college age, in college, and so in talking with him about it for quite some time, because of spring break and the different things that people around him were doing, he kind of did not understand the global pandemic event that we're in. So in this hour, how do we kind of move forward and not have to, I guess, maybe have as many conversations to really kind of make it understood to them that this virus impacts everyone of every age demographic?
Dr. Calder?
Yes, well, I think it's important that we address one of the myths that is causing, I think, young people to believe that they're not at risk. And that myth is that only older people are affected by the virus. That is definitely not true. We're seeing about 20% of people that are infected with the virus are in the U.S. are in the 20 to 44 age group. So it does affect younger people. And these are hospitalizations, I should mention. 20% of 20 to 44-year-olds are being hospitalized because of the disease. And what young people, I think, don't understand is while they may not be at higher risk for severe illness if they're healthy, or death, not as high risk as 65-year and older individuals, they are at risk to pass the disease along to people who are unable to deal with it. So, yes, you may walk around and feel okay, but you may be a carrier of the virus and may be passing it on to an older individual or someone with a depressed immune system. So I think that information is what we need to focus on. So that
But you know what, Dr. Calder, I think part of the problem though is, and frankly, we've got to blame all those folks who at these news conferences. The problem is they said, hey, if you're young, you know what, you're good. And that was a problem. Now all of a sudden we're seeing these cases of 20 people who are 20, who are 25, who are 28, who are 30. In fact, almost 30% of the people who have been infected with coronavirus of the CDC study between 20 and 44, 29% of them between the ages of 20 and 44. And so the people who are talking have got to stop saying it.
Yeah.
Because it's created this whole invincibility. That's why you got all the people who are out there on South Beach and everywhere else in Florida and other places saying, hey, yeah, we all good, because all they kept hearing is, you're young, you can't get it.
Right.
Absolutely, absolutely. I think that is information that we need to really stop saying and stop putting out there at this point, because so many people are being infected with the virus. It's spreading everywhere. It's spreading very rapidly. I think initially the reasoning behind that was to not cause too much fear and hysteria. So I think they wanted to emphasize the fact that about 80% of people that are infected with the virus have a mild or moderate type of illness. But I think at this point, what we need to emphasize is that it can affect people of all ages, including children, and it can be passed on to people who may have severe illness if they were to catch the virus, or who may, have a high risk of death. So I think that's what we need to now focus on, because it's now in all 50 states, and it's every day the numbers are just going up and up and up. So.
Dr. Calder, one of the biggest things that people used to kind of dismiss it is they say that this is just like the flu. And, plenty people get the flu every year, plenty people die from the flu every year. Why is this even a big deal? Can you kind of address that a little bit?
Of course. So I know, people do tend to compare this to the flu. I think one of the differences between this disease that we're dealing with and the flu is that this virus seems to spread a lot easier than the flu from what we're seeing. And that could be due to a number of reasons. One of the reasons is because we do have a vaccine for the flu. And while everyone does not get that vaccine, a number of people do. So that helps to keep it from spreading the way we're seeing COVID-19 spread. So I think that's one of the reasons. So because we don't have a vaccine, because at this point we don't have a treatment, that goes to show that at this current moment, this virus, this disease is more detrimental, I think, to the public than the flu is.
Can you also, one more thing, I saw, on social media, there are various athletes and famous people who have been, who've tested positive even though they don't have symptoms. And so some of the comments that I've read within those is that people, well, how would, why are you even being tested if you don't have any symptoms, or these people are lying, they're being paid to say this. Can you just kind of address kind of people who think that, well, because these people aren't symptomatic and they're positive and they appear to be doing fine, that there's some sort of hoax going on?
Okay, so yes. Well, first of all, there's an incubation period for the virus. It's anywhere from about 2 to 14 days from what we can tell. So you can potentially have the virus for up to 2 weeks without any symptoms. That's number one. So if someone were to test you, you could be positive and maybe just asymptomatic at that point. Secondly, some people are being tested who may have had a contact with a positive. And while they don't have symptoms at the time, they were in contact with someone else who was positive. So just because that person tests positive and they were tested, but they hadn't developed any symptoms prior to testing, that doesn't mean that this is a hoax. It's very possible, and it makes absolute sense.
All right, Dr. Shadrina Calder, we surely appreciate it. Thanks a lot.
Thank you.
All right.
All right, folks, back to our Roland Unfiltered video in just one moment.